Mammogram debate after some of the dust has settled in Washington on those controversial guidelines. What should you and your family do about these recommendations? A doctor from Alvarado Hospital joins us live.
San Diego 6 News in the morning. Your station for balanced news.
And a heated controversy over the new mammogram guidelines. Our guest discusses the details you need to know about protecting yourself from cancer. It's been a topic many women have been talking about lately. New guidelines for mammograms were released a couple of weeks ago. According to the guidelines, a woman with no family history of breast cancer may not need to get a mammogram until the age of 50. With more on this, we welcome Dr. Reza Shirazi from Alvarado Hospital. And Doctor, a big controversy. These guidelines were released and automatically you were hearing from both sides who are very passionate about their stances on this. Let's get right to it. Age 50 to change that from age 40. Why such a drastic and dramatic change? Because 10 years, that's a big deal when it comes to tracking breast cancer in women.
That's correct. The same group looked at the same data back in 2002, and they came with a recommendation of getting it done after age of 40 every 1 year or 2 years. They reevaluated the data with more of the specifics into it, and they changed their recommendation basically because of the false positive that screening mammogram can cause at earlier age in women. The women at between 40 to 50, they have a denser breast, so it results into more false positive, more mammogram, more biopsies and procedures that comes after that, and they argue that there is more anxiety that goes into the equation, and we really need to know how many women need to be screened before we cause all these anxiety worthwhile. And they came with a recommendation, maybe it's better to change that criteria to age 50, and that's the argument of this task force.
Which is obviously understandable, but you know, for some women out there, they're saying, wait a minute, isn't it better to be safe than sorry? What do you say to that?
That's absolutely correct. So it really boils down to the patient's comfort and their risk factors. Same group also recommends in women that have a high risk factor to stick with the guidelines at age 40, which is the American Cancer Society, American College of Surgeons, American College of Radiology recommendation. Stick with that age 40, and then after doing the screening mammogram, once a year or once every other year doing the mammograms. But if the patient is comfortable with that recommendation of waiting till age 50, if they don't have a high risk, it's okay for that patient to discuss it with their physician and really make sure they don't have any risk factor to get it done sooner. But if they're not comfortable, as you know, we get many women, they come to our office at age 35 or younger, and they want to get a mammogram, and say, okay, really, you need to wait a little bit before we do that. And what the recommendation of this task force to Health and Human Services, U.S. Health and Human Services is, and most of the insurance companies buy into it, unfortunately, it's going to change, you know, it's going to go into the play, and people may not be covered.
Right. Well, let's talk about high risk, though, because if you do have, you know, a mother or a grandmother or an aunt who has had breast cancer, you know, that's what they say. They say that that's one of the #1 reasons why you should be tracking it early. What's the recommended age then? We're seeing women now in 20, 21, 22 being diagnosed. So when is it time to go get one? If you have
genetics, very good. Genetics predisposition, first degree relatives, and the youngest age of the relative that was your first degree relative that had the cancer should really guide the patient and the physician when to start doing the screening mammogram. If somebody was diagnosed at age 45, that patient probably 10 years prior to that age should start getting screened for the you know, breast cancer with the mammography. Mammography, for all its imperfections, it is still the best test we do have out there for screening. It is low cost, and probably the 1/3 of the people that don't have access to mammogram is the health gap we need to close and make sure they get diagnosed with breast cancer, because they're the groups that present with late stage of the game. The problem with waiting later to get screening done, the sooner we do the screening, we find disease at the earlier stage. So the same woman that would come with the earlier stage of the disease that may not require chemotherapy may need to get a more aggressive treatment if it is found later. But the other thing that goes into the equation is we are detecting things that are called in situ, non-invasive, pre-invasive breast cancer at the earlier stage of the game, which is very slow-growing disease that could have waited and been detected a little bit later or every other year instead of once a year.
All right, doctor, thank you so much. We could talk about this all day. So much still left to debate. I'm sure this is not the end of it, but thank you for your insight.
Thanks for inviting me. Of course,
for more information, just go to our website right now, san diego6.com, click on Hot Topics.